I'm Rick Buck, and I've been a dentist for 17 years. This patient is unhappy with her smile for a couple reasons. She doesn't like how one of the front two teeth goes up higher. One tooth shows gums and the other doesn't when she smiles. She's also unhappy with the dark spot between her two front teeth. She also obviously doesn't like the cavity on her upper left canine. The optimal treatment would be to have gum surgery on all the upper front teeth to even out the gum level, and then after the gums heal, do veneers and crowns on all the upper 10 front teeth. That would get us a fully cosmetic smile, but that seemed excessive to her. So the backup plan was to just do crowns on the front two teeth with a little trimming of the gums and a few white fillings to replace some of the stained teeth. Let's get started and I will tell you why along the way. After the patient is numb, the first thing I do is trim away some of the excess gums over the upper left center tooth. Now, the good thing is this is where we want the gums ultimately to be. However, the gums will eventually grow back a little, which is why the full gum surgery would have been a better and more predictable option. Also, when I do this, I have to be a little bit careful to not move the gums too high, because the dark spot that she's also unhappy with can be exacerbated by moving the gums even higher up. Because we're not doing the optimal treatment, my goal is to just get the difference between the gum level on those front two teeth a little bit less than 1.5 millimeter discrepancy. And because research has shown if those two teeth are less than 1.5 difference in height of the gums, that people really don't actually notice it that much. But now moving on to our next step is to remove the crown on the upper left front tooth. We do that by drilling a slot through the front tooth. With a slot in the front tooth, we would normally pry off a piece at a time, but you can see one piece just falls off. So we have to just grab the other piece to pull it off. That extra piece doesn't come off right away, so we drill a little bit more of the tooth away, and finally the piece of the tooth just breaks free as we wiggle it. Okay, so now with the crown off, we have to refine the remaining stump of a tooth, but us dentists call it the prep. Where the tooth and the crown meet is called the margin, and what we have to do is make the new margin of the crown down slightly below the new gum level. And the margin where the new tooth and the crown meet is actually going to be the line where we drilled versus where we haven't drilled, that goes all the way around the circumference of the tooth. The margin is important for a few reasons. The biggest reason is that this is where the tooth and the final crown will meet and is the weak point of the tooth going forward. There needs to be a smooth transition from the tooth to the future crown, or decay, bacteria, and plaque can easily enter and cause cavities, making it impossible to keep it clean if done improperly. Another important reason in this case is that making the margin far down below the new gum line will help limit how much the gums will grow back, because once again, they will grow back some, but if they notice there's a crown there, they won't grow back as far. After filing this tooth down, we then turn to the other tooth to file it down. Quickly, before I get to the most interesting part, I developed the best toothbrush, floss, and other dental products that are in Amazon affiliate links in the description. Those dental products will give you a stunningly clean mouth. You should watch my videos about why they are the best, posted at the end of this video, so you brush and floss with superior results. In case you're wondering why we're even touching this tooth with a drill, to get optimal cosmetic results, you need to match teeth on one side of the mouth to the other side of the mouth. If we only did one tooth, it would just be too difficult to get the teeth to match each other. Like I said earlier, the more teeth you do, the better the results will be. So as I drill for crowns, I want to make notes on other characteristics about the remaining tooth. The remaining stump of a tooth has a perimeter wall that converges at about 5 to 10 degrees. If it is more than that, the final crown is more likely to come off from time to time. If it's less than that, the crown may not fit or might even get stuck on the tooth when you're trying to fit it in. Either way, 5 to 10 degrees will give it a lot of retention and still allow for the crowns to fit. We remove 1.5 millimeters in thickness because a crown is going to fill in all that negative space that we drill away. If you just put a crown on top of the tooth without drilling it down, when you bite down, you would only bite down on that tooth due to its added thickness. The thickness needs to be at least 1.5 millimeters for these things not to break. Okay, so now I just stopped to analyze the remaining teeth I just filed down, and everything just looks like I want it to. So now we need to take an impression so we can make a model of the teeth. But first I stop the gums from bleeding so I can get a detailed impression or scan of the margin. I usually take scans now, but for this video, I will do impressions. We do this in 2 steps. First, I take an impression with a quick setting hard material called Blue Bite. Then I remove the impression when it is hard, and second, add a more detailed impression material layer. And I snap that new impression back into place, so this method pushes the material below the gum level to get a highly accurate impression of the tooth and its margin. We will get that crown back in a few weeks. Now, we start making temporary crowns that the patient will wear for a few weeks while the permanent crowns are being fabricated. Something I didn't show is we took a preliminary impression at the beginning of the appointment. I fill the prelim impression with a fast setting acrylic and snap it back into place in the mouth. After a minute, that acrylic is mostly set, and we take out the impression and acrylic and start refining temporary crowns so they look pretty good. And if the patient paid an extra fee, we can make these temporary teeth more cosmetic. But as you can see, these crowns look pretty good, and we fasten them in with temporary cement. But now let's fast forward, and a few weeks has passed by and the patient is back, and this is what it looks like. Yes, the gums are still very red and healing. Don't worry, this will go away, and I will show you that it goes away. But we take off the temporary crowns and clean off the temporary cement. We are now ready to fit the crowns in. As I try them in, I am observing for 5 things. First, we make sure the crowns contact the adjacent teeth adequately so they don't get food caught in them in the future. And we do this by using a floss to see if it snaps nicely through. Second, we ensure the crowns sit down all the way and don't rock, or they would likely loosen in time or have other issues if they did. Third, we make sure where the tooth and the crown meet is flush, otherwise cavities can easily start at the margin. Fourth, we check the patient is biting evenly on the crowns. Fifth, we make sure the crowns look good. Our patient loves the way they look. The dark triangle spot that was between the teeth is filled in by bulking up part of the shape of the crowns, and the gums will actually fill in that remaining area in a few days. And while I love the height of the gums right now, they will rebound a little bit in the next few days, but my patient loves the way they look and feel with a little adjusting. We still have a little to do, so the patient returns in a few days to have the decay on the front teeth taken care of. And I'll just quickly show you how that happens and the results of that, because I have plenty of other videos if you want to know more on this. But we remove the decay, then we etch the surface, apply bond to the slot, set it with a light, put a white resin filling in, set it with a light, then smooth out the filling, and lastly, polish the filling. Now, as I show you the after pictures at this appointment, you can see things are much more cosmetic. The dark spot between the front teeth is completely gone. When the patient smiles, the gums no longer show on either of the front teeth. And the discrepancy behind the height, as you can see, has rebounded a little bit from when we trimmed them. If the patient wants, we can still do gum surgery and lift the gums on the front teeth again once more in a more permanent and predictable way. Watch all my daily tooth care videos I have posted now for the best techniques, tips, and products for a stunningly clean mouth that avoids tooth decay and gum disease and gives you fresh breath. My dental products are in Amazon affiliate links in the description below, and if in Southern California, my dental office is in the description as well. Like and subscribe to my channel if you have teeth.